Ku family!
You know, when you want to get pregnant, everything that you see is related to getting pregnant. And everywhere we looked in the mall was a pregnant woman with a stroller and 3 babies in tow, and that was tough. That was tough. So it was pretty ironic and embarrassing that as the infertility doctor, it was hard to start a family myself. And together we sat down, we said, you know, I think we are not going to stop. We're not going to give up. We want children, and so we continue to try. After we tried some home remedies and some over-the-counter remedies, nothing worked. And because I was in training, in infertility training, I thought, well, maybe I can figure this out myself. So I sent my wife to go get some blood testing, and I couldn't find any reason. Everything came back normal. We started really conservatively with some inseminations, with some Clomid, and that didn't work. Then we moved to Clomid with some shots and insemination. That didn't work either. 3 rounds, we really started to kind of think about, is this going to be our lives? No children, or are we going to continue to try? So we were at this crossroads, and we weren't sure what the answer was. At that time, we moved to Dallas, and I started my job here at Dallas IVF. And we had a chance to sort of have a second set of eyes, look at our problem and see if there was another way we could fix this. We had to use the lab here, and with another round of IVF, it worked. And our son was born. And all that frustration and all that despair, all those shots and those nights of worrying washed away. So my son being 9 months old, we went through another round of IVF. And luckily, it worked again. And we had my daughter. One thing I tell my patients is that my wife and I, we may have taken a little bit too long of a time trying those conservative methods. And it took us 3 or 4 years before we decided to do IVF. I tell my patients, definitely consider conservative methods if you want, but don't wait too long. If you need to jump to IVF, let's jump earlier. Before the technology of pre-implantation genetic screening, we put in 3 embryos ourselves because we weren't sure which one's going to turn into a baby, and plus they were of low grade. Nowadays, the technology has advanced so properly and so well that we're getting better and better at achieving pregnancy with IVF. Now we're recommending 1 embryo to go in because the chance of success is so high. If we were to put in 2 embryos, the chance of twins is high. And we want to try to avoid risky situations for the patient, so we recommend 1 at a time. I tell them this isn't a sprint to the finish line, as much as I want it to be. We want that baby yesterday, and I do too. But this is a marathon, and the journey can be filled with ups and downs. Based on how my experience was as someone who suffered with infertility, I want them to know I'm here for them. I understand how they're feeling. I understand if they're frustrated. I understand if they're depressed. But it also helps me work harder for my patients. I hold my kids a little bit longer just because I know that I almost didn't have them. And every time I look at them, I always think, I almost didn't have you. I'm so happy and grateful that I have you.